Hi, this is Deborah Taylor. I'm in occupational health with Dr. Ivan Most, and I'm going to talk a bit about OSHA as a success when it comes to limiting workplace injuries. OSHA, as you know, is a federal organization that was established in 1970 under the Nixon administration with a mission of assuring safe and healthy working conditions. Has it been successful in doing so? I believe it has. And I'll provide you with some information and statistics that hopefully support that. A little bit about the standards histories. These have been established over the years as the standards continue to progress, and they represented and continue to represent the agency responding to the needs of the workers and the evolution of hazards and risk identification, all with the goal of lowering worker risk and lowering the injury and death rate. In the early 1900s and continuing through to the 50s and 60s, although worker safety was at risk, efforts were made to improve those conditions. The efforts, though, were made at the state level and were not coordinated at the federal level. It was OSHA that put these regulations together and standardized them. Although the data from the early 1900s is limited, here are some of the injury and death statistics and a comparison to later statistics. Steelworker deaths decreased dramatically. Of course, we have data from 1906, 1907 in one county where 195 steelworkers were killed. And then in 1997, 17 steelworker fatalities were recorded nationwide. Deaths from all industries or in all industries went from well prior to OSHA at 61 deaths per 100,000 workers to after OSHA in 2006, 3.9 deaths per 100,000 workers. Injury rates dropped from 11 per 100 workers in 1972, first to 3.6 injuries per 100 workers in 2009, then a further drop to 3.3 injuries per 100 workers in 2013. Clearly, injuries, and more significantly, the deaths resulting from those injuries, have been proven to decline post-OSHA. This just shows further decline in injuries and illnesses in later years, but even as OSHA is continuing to develop regulations and standards, the injury rates are declining. This is from 2003 to 2014. Part of OSHA's job is to ensure compliance with its regulations. And while inspections may not seem to be a benefit and may not seem to have a huge impact, they are proven to have a huge impact on reducing injuries. Inspections between 1998 and 2005, where penalties were assessed, there was a 19 to 24% reduction in injuries annually. And what's more important, I believe, is that improvement was sustained for at least 2 years after these inspections. There was also a study done in 2012 where random inspections were done against controls, and those resulted in a 9.4% decline in rates of injuries and a 26% decrease in injury costs. Adding to the power of OSHA and contributing to the success it's had reducing injury and death are its programs. Those participating in the STAR program, for example, have greater than 50% below national average lost workday rates. It also improves productivity and morale. The SHARP programs and ECAP programs are helping employers develop their own safety programs, helping them comply with the standards and the regulations, and thus reducing workplace injuries. An added benefit, and although these may not be directly linked to decrease in workplace injuries, I would assert that these statistics play a role in keeping our workplaces safer. OSHA improves workplace performance. There are fewer absences. Processes and technologies, mechanisms have been developed because of OSHA, and these absolutely decrease the number of injuries and fatalities that workers experience. There's a huge return on prevention, return on investment for safety and health measures. This kind of says it all. This is a quote from the CDC in a 1999 MMWR. It is clear that OSHA has been successful in decreasing workplace injuries and death, and the world would be a different place. Our nation would be a different place without its regulations and its safety programs. Thank you for your time. Here are some of the references that I've used in this presentation. And again, thank you.